Really glad that Tara is here with us today, and we want to kind of rush through the introductory business so that we can get to the important topic that you have today, which is going to be the lymphatic system. I was in having a massage by Tara yesterday, and we got talking about the topic for today, and I told her that years ago when I was in nursing school, I remembered learning that that seawater and blood plasma had the same salt concentration, and it was only, believe it or not, in some of my recent research that I learned this very week that lymph fluid has the same concentrations. So we were able to share that and say, hey, there's always something new. And I want to turn it over to you now, Tara, so you can teach us all about lymph and what massage can do to help the lymphatic system.
Thank you, Sunnie, and thank you again for having me on this show.
Thank you.
First of all, what is the lymphatic system? I'm sure most people are asking themselves. It's not a very well-known system. Of course, physicians and nurses know about it, but ordinary people don't really know about it. It's a secondary circulatory system. So it's part of our circulatory system. The only difference is it does not have any involvement with the heart as far as pumping it. It's a one-way system to clean out our interstitial fluid, which is the fluid that connects all of our cells and keeps our body all together and just regularly needs to be cleaned out. Mm-hmm. And so the lymphatic system is very important in that it filters all of our body's fluids back to the blood so that it can be cleaned and recycled.
And we have a picture on the screen right now to show the lymphatic system. And let me ask you a question, Tara. When I'm looking at that picture right now and I see that concentration of tissue up under the arms, I know that the lymph nodes are concentrated in that area as well as in other parts of the body. And I know from my own experience, this is some of the tissue that you work on.
Exactly. The lymph nodes that you're talking about, those are the main parts of the lymphatic system. And as you said, they are gathered in the axillary region, which is the armpit, the cervical region, and the inguinal region, which is why when you go get a physical, a doctor will usually check your throat. They'll usually check all of your lymph nodes to make sure that there isn't any disease, because swollen lymph nodes is often an indicator of disease.
And not necessarily serious disease.
Right.
It can be.
It can be oncoming.
Right,
disease.
And it can be just a bad cold
Exactly.
that your body is cleaning out.
Right, which is still pathogens and
Mm-hmm.
you know, bad cells that are trying to get cleaned out. And with the lymphatic system, it's very important for our immunity
Mm-hmm.
because it has the T and B killer cells that go in and help take out cancer cells, and just it increases our immune system. They're the white cells that are found in our blood as well when you get a blood count, the WBC.
Mm-hmm. Mm-hmm.
So those are the cells that all around our body are moving to just try to keep everything fighting disease.
And they're concentrated in the lymph fluid as well as even more so in the nodes.
Exactly.
Okay.
The lymph nodes are basically, like I like to say, they're kind of reservoirs. And then we have all these veins. They're like veins, but they're actually capillaries and vessels in the lymph lingo. But they're just like all the veins running throughout our body. And actually the picture that we saw is only showing a little bit of them. It's just showing the concentration. But they're all over our body. We have them in our face. It contributes to, you know, the fatty deposits we get under our chin as we get older and whatnot, because lymph fluid isn't getting cleaned out. And a lot of people ask me, well, how come our lymph isn't getting cleaned out if it's, you know, a system that's designed for that? The thing is, nowadays, as you know, Sunnie, our toxins are just so high. The toxins that we're exposed to in our environment. Mm-hmm. And so our lymphatic system is having to fight harder and harder. And the only thing that helps the lymphatic system move, like I said, it doesn't have a heart or a pump to help it move. It relies on physical activity.
I was going to ask you about that.
Which creates muscular contractions. And that's pretty much it. Any kind of activity that's around the lymph vessels that can kind of pump them a little bit is going to get them to move. Otherwise, they don't move.
Because they don't have a heart pumping them. Debbie,
right.
Exactly.
Terry, you're always, when I get a lymph massage, you're always like telling me we can do that ourselves too.
This
to
is
keep
true.
that moving, right?
Mm-hmm. That's
Okay.
true. And
how would you do that yourself?
The way I tell people to do their self-care for lymphatic is to pump the main lymph node areas. And the important thing is to always remember, start at the core, at the center because it's kind of like the big lake. If the lake is full, the reservoirs can't drain into the lake, and the ditches or rivers or whatever nothing can keep draining if the main area is full.
Okay.
And so the main areas, I like to tell people, just so it's real simple, as far as massage therapists, it's much more detailed, and we're very conscientious the whole time of the direction and where we're pumping and how the strokes are moving the fluid. But as a maintenance deal for self-care, it's a lot of detail. So it's easy to remember to just think about Tarzan. And remember how Tarzan? Tarzan. Yeah, he was so healthy, swinging around on vines,
Yeah.
Well, they say Tarzan was so healthy because he kept his lymph going by going, and beating on his chest.
Believe it or not, I just watched the Johnny Weissmuller movie of Tarzan, like from 1930 something on Turner Classic Movies.
What a
he was
coincidence.
Great. No wonder everybody was kind
And
of
she
in love
really
with him.
did. I heard this story.
I can't believe you would say Tarzan.
So funny.
So anyway, back to the topic though. So his
Back to the
activity, doing all of that physical stuff, cleaned out even his core,
Right.
lymph.
But the thing with Tarzan is, remember how he would go like this on his chest?
Yeah.
And so that's why I tell people to start. It's hard because I have this
She's
microphone.
probably trapping her mic.
Oh,
Yeah.
I'm trying to keep away from my microphone. But basically, you just tap in this area, and that starts the subclavian lymph nodes, which then helps drain these lymph nodes.
And Tara, what'd you tell me? There's like 40?
Oh, there's so many, and they're little.
Just in the chin?
Oh yeah, there's so many, and they're just little pea-sized things. They're not huge, so that's how there can be so many of them.
I know you have them in the back of the
You
neck.
do?
One time when I was a young adult in nursing school, actually, I had a case of mononucleosis. They call it the kissing disease, but believe it, I didn't get from kissing. Nobody was kissing me, and vice versa. Anyway, I could feel at that time, this big chain of nodes in my neck, and it took a long time before they finally cleared and got back to a normal size.
Mononucleosis is a contraindication for massage while it is in its acute stages.
Oh,
Actually,
okay.
now that you mention that, it is a disease of the lymphatic system. It's
Oh.
overburdened, and whatever the cells are doing, it's not working, and I don't know all the specifics about it as far as mononucleosis and whatnot.
So, Tara, is there ever a time when you shouldn't get a massage?
Well, if you have mononucleosis, you shouldn't get a massage.
How about another viral type infection?
What else?
Other stuff.
If you have the flu, if you
What
have...
about cancers? When you're going through treatment or something?
Right
Is
now,
that a good time?
cancer, their research is leading to show us that it is beneficial for the cancer patient because, as you know, that's where the cancer is cleaned out through the lymph nodes. And when a woman has a mastectomy, often, most times, they'll remove the lymph nodes in the axillary, or some of them, or part of them, to make sure that it's not traveling and going to metastasize elsewhere.
Metastasize.
Yes, thank
Yeah.
you. Elsewhere or in the region.
I got a question on the anatomy of the lymphatic system. So is it closed? Like when the fluid goes into a node area, where does it go from there then? Does it go back into the lymphatic system when you get that moving again? I mean, I would understand that fluid comes into it from the blood vessels in the body, so it's constantly being fed. And then is it like the Dead Sea, or does water ever go out of it?
There is an exchange going on as it is taking the bad cells out of our interstitial fluid. It's sending in the killer cells, the T and B killer cells, the white blood cells that help our immune system. It's a one-way system, Sunny. So it is just always trying to get everything back to the core and to the heart, and it's drained through the thoracic duct and then back into the heart through the circulatory system. The liver comes into it, the spleen comes into it, even the thymus comes into it because it secretes hormones. But the main anatomy of the lymphatic system are the nodes themselves. The picture that we saw earlier showed the main, the cysty, excuse me, I can't remember the name right.
I'm not sure where you're going.
I was trying to remember the main lymph node in the stomach. The chili.
I really don't know. It sounds like maybe after we had our green chili. I don't know.
Whatever that
It's
name
just
is.
slipping my mind right now.
Yeah.
But we always start the massage at that point
Okay.
as massage therapists. But back to the self-care thing, and just want to let you get that on your show. You start here, and then you just tap in your throat a little bit.
Tap or move like that.
Tap. The massage strokes are a milking, tapping, feathering.
But you're always
massage.
very light with that.
It's
too.
very light because
Very light,
the lymph vessels and lymph nodes are very superficial. Whenever you get sore throat, your mom always feels your throat,
Yeah.
and sometimes you'll have one of the sides will be swollen, and you can help drain that yourself by starting down here and then just lightly tapping, pumping, feathering, just
Okay.
light touches helps
My
get it going.
thinking on this, and tell me if I'm right or wrong. So if I have a viral infection going on and my lymphatic system is helping to knock it out, I would imagine those viruses in the nodal areas are getting killed. And so they're going to be breaking down into their components, which at that point they're not dangerous, and they can be moved out of the interior part of that system then, and they can freely go in just to be discharged in normal mechanisms.
And filtered through our...
Yeah, yeah. Well, that makes a whole lot of sense.
A lot of times, though, when you do have a viral infection, because there's so much going on, we want to wait until your doctor has cleared you via your treatment with antibiotics or whatever is going on, and gives us clearance to go ahead and give you the massage.
Keeping in mind that antibiotics are only useful in bacterial infections.
Oh, yes,
exactly.
Sometimes a bacterial infection will come on after a viral infection, but in the early stages of a viral infection, before it's been demonstrated that there is any bacterial infection, an antibiotic isn't really useful. Now, on the other hand, sometimes they are prescribed at that point, and we don't really recommend that. So is there anything you want to get in? We've only got just a few seconds here before we need to take our break, Tara.
Basically, lymphatic massage is recommended as a preventative measure. It's a lighter massage, and it's like getting in oil change. It's recommended for everybody at least every 3 months.
Well, that sounds great to me, and it's very interesting to learn about the different systems. I think that we did talk briefly at one point about the two nervous systems that we have, and we have these two circulatory systems to a point, even though we don't have a pump for the lymphatic system. Well, we want to thank you very much, Tara, for being with us today, and we want to thank all of you for